Hi guys, this is John Adamson, the Rehab Man Documentation Guru, driving and making a video. Not maybe a wise choice, but I am keeping my eyes glued to the road. And anyway, I just wanted to cover something with you on the skill involved in electrical stimulation. So what is the skill involved in ESTIM? Well, I'm talking mainly to those of you that bill for minutes and units of time. And the most typical code that is billed to Medicare for ESTIM is the G0283 code, which is actually termed a HCPC, not a CPT. Anyway, what that means is when we bill that code, we bill 1 unit regardless of the time we actually did skill. But we should account only for the minutes of care that were truly skilled. So what constitutes skill for ESTIM, G0283, or any ESTIM? Well, one thing is obviously setup and breakdown. And during setup, you are obviously doing things like skin preparation. You are doing also making sure that the patient is in the right anatomical position, making sure you've got the right number of pads, that type of thing. So all of these factors need to be brought into play in your documentation to prove what you did was skilled. The other thing is the parameters of the ESTIM. So setting up the ESTIM itself is going to be skilled. So looking at things like the type of waveform you're using. Maybe it's symmetrical biphasic, maybe it's twin peak monophasic. There's a reason for choosing the waveform, and by choosing a waveform, you are demonstrating a skill because each waveform has a little bit different capability when it comes to therapeutic outcomes. The other thing is, obviously, we look at other parameters like the duration of the phase. So if you're using AC current, a symmetrical biphasic, the fact that you are setting on a certain waveform duration allows you to impact the patient's action potential of the nerves that you're trying to stimulate. And then also frequency. For example, low frequency, like 2 to 10 cycles per second, usually produces a non-tetanic contraction, which stimulates endogenous opioid production. And then a mid-range, 35-ish to 80 cycles per second, produces a tetanic contraction, I keep screwing up, of the muscle, which is really good for muscle re-education. And then 80 to 150 cycles per second is generally considered the nerve block range, where you're getting sensory nerve block through the good old gate theory, and that's good for immediate pain blocking response. So there's that too. There's the frequency, and then duration. How long are you going to keep the ESTIM on? But the whole whole duration is not necessarily skilled, because you can observe the patient from a distance without doing any direct skilled input, and that would be perfectly fine. The other thing that is skilled is periodically having to adjust the patient, adjust the ESTIM unit, because let's face it, the response might not be the same. And so, for example, if you're doing muscle re-ed, you're looking for those contractions of the muscle, so you may have to readjust to get better contractions. All of those things are skilled. And then, of course, breakdown, where you take the pads off, you verify that you get the response that you needed. You're looking at the skin to verify that the skin check is showing no adverse effects on the skin from the ESTIM. And that's it. That's a document that proves that you're necessary. So just a little case study. I was with a patient the other day who has a TENS unit. Never used it before. She has a very old stroke. She also has a lot of dementia, very much towards late stage. So she's very impaired. Now, first of all, dementia is a precaution of use of ESTIM, not a contraindication. However, you do have to be really careful. And with her pain, she's got decerebrate posturing of her upper extremity. And if you're not familiar with that, just, you can Google it, and it's pretty easy to see. And you've seen it probably before if you've been in the field for a while. Anyway, decerebrate posturing of our upper extremity with lots of pain. And so I documented, first of all, the waveform we chose was a high frequency, which tends to be much more easily tolerable by patients than the low frequency endogenous opioid mediating frequency range. That tends to be kind of caustic, and with patients with dementia, probably not going to tolerate it. You still have to be careful of how you adjust it. And so that's what I was looking for. Was part of my skill was adjusting it to a threshold that she was comfortable with. The other part of my skill was putting it where I needed to. And part of her problem with her posturing was she was not allowing anybody to range her outside that posturing. So my skill was getting the right anatomical location for a nerve block to allow some range of motion to occur. And I found that my best block was basically proximally and distally rounding the ulnar nerve to hit the wrist flexors, and then also surrounding the thoracic inlet and outlet for the brachial plexus, which helped break up her shoulder guarding that she was having. So anyway, all of these things, and I documented basically what I just told you, are demonstrations of skill. And so if you want to get paid for ESTIM, which frankly is reimbursed pretty poorly, especially for Part B type billing, although for right now, while therapy is counted for minutes, for Part A, it's a decent reimbursement when you think about the time that goes into billing. However, Medicare for Part A is looking at any minutes above 15 minutes per application of ESTIM as being suspect. So it's hard to get reimbursed for more than that in total time. But you still got to document the skill behind it. And that will go a long way towards proving that you are necessary, and helps paint a broader picture of the medical necessity picture. Anyway, this has been John Adamson, the Rehab and Documentation Guru, talking to you about the skill involved with electrical stimulation. If you liked the video, please subscribe. If you have not done so already, please send me a comment. Feel free to email me at adamsonenterprises1@gmail.com for any suggestions for future videos. Take care, God bless, and have a great day.